Hello and welcome to See What We See with Lorne Martin. My name is Lorne Cashin. I'm the Executive Director of the Ontario Opticians Association, and I'm here with my co-host, Martin LeBeau, Deputy Executive Director of the Ontario Opticians Association. See What We See is a podcast series dedicated to bringing you an optician's perspective on vision care and how it fits into your broader healthcare. On today's episode, we'll be discussing the relationship between nutrition and vision care. We'll be joined by Dr. Nisara Bandali. Our discussion today will include the common causes of vision loss in the elderly and also how food choices can help protect against some of these diseases. Martin, why don't you introduce our guest today?
Thanks, Lorne. Yes, hi everybody. I'm just so happy to have here as our guest speaker, Dr. Bandali. Hi, Dr. Bandali. How are you today?
Good, I'm good. It's great to be on here with you guys.
Well, thank you very much for joining us. Healthy diet. I mean, that's a term that we hear a lot today, right? We should all eat healthy and everything else, but what's really a healthy diet?
So that is a very interesting question, because if you would have asked me this, 15 years ago, it would have been something completely different. Even our food pyramid has now changed into decreasing all that carb into more vegetables and healthy proteins and legumes and fruits and whatnot, So a lot of these things have changed over the past few years. And the beauty about, the eye itself is that it's so connected to the whole body, right? So when we say diet, I mean, instead of eating foods that are high in, processed sugars and, more processed foods, go for the more natural foods, go for the vegetables and the fruits and the fish, that it has omega-3s and certain types of anti-inflammatories that can help decrease a lot of that inflammation in the body, decrease the stress on the body, things with darker colored, vegetables like kale, spinach, broccoli. I know that sounds delicious, doesn't it? But those are amazing for the eyes. People say eat carrots. I say, eat dark pigmented vegetables. They are the vegetables that are going to replenish these pigments in the back of the eye. So there are certain supplements that optometrists and ophthalmologists and opticians can recommend. There's Vitalux that I believe is by Alcon, but these and Preservision, and there's Ocu Health and Macu Health, and there's so many different types of vitamins that are basically like concentrated vitamins and pigments that are stuck in a little pill that you can take. And I don't necessarily recommend that you just take them just because sometimes all these vitamins are a little bit hard on the tummy, and it's more of a, your doctor should recommend that for you, or your eye care professional should recommend that for you, knowing that you are at risk of, macular disease. But I don't necessarily, I think supplements are good. Like, for example, blueberry extract supplements. They're really good for your eyes, full of antioxidants. It's a dark colored pigment. It's known to actually decrease the progression of AMD, which is kind of cool. Certain types of supplements like lutein, for example, you can get that over the counter and take that. But lutein is also very good for your eyes.
Dry eyes. I don't know if it's just me, but I think we're seeing more and more of it, and we're seeing it more at a younger age, not just in our seniors. So maybe you could tell us a little bit about what you're seeing when it comes to dry eyes?
Yeah, I completely agree with you. A lot of patients come in complaining they have intermittent blurry vision, mostly, when they're at their computer, their eyes start to burn, when they wake up in the morning, their eyes are puffy and red, and at night, sometimes they have like sharp pains at night. And dry eye is such an interesting disease because it doesn't just happen to the elderly. It happens across the board to anyone and everyone. Sometimes people don't even notice that they have dry eye because the signs show before the symptoms. But when we're looking in the front, we see that the tear film when we blink, what happens is there's little glands in the eyelid margins that actually get squeezed out, kind of like a windshield wiper effect. And it lubricates the eye, because when the corneal nerves, the cornea is like the front of the eye, for those who don't know, the clear part of the eye in the front, the nerves are exposed in the cornea. So sometimes when it's really cold outside, you start to tear up. When you get an eyelash in the eye, you start to tear up. So it's super, super sensitive. And when we see that tear film on the eye is not sufficient enough for the cornea to be covered completely and moisturized by the natural tears of the eye, we notice that there is a high rate of evaporation of the natural tears of the eye, the natural lubricants. We notice that there's also a decrease in the production. So when we squeeze these glands, which we can do with our fingers, it's kind of fun to see, but when we do squeeze these glands, we see that instead of like an oily consistency, like almost like an olive oil, we start seeing like a toothpaste-like consistency coming out, or nothing at all, or somewhere in between, and it's kind of cloudy. And those things are all signs of dry eye, where your eye is not producing enough tears. And a lot of that is to do with, of course, like you guys mentioned, your diet, and your overall lifestyle. Certain medications, like blood pressure medications, dry you up like this, and women suffer through it a lot more as well, because of, certain types of hormones during certain types of months. Men suffer through it as well, because, we see that a lot of men don't really pay attention to their ocular health. No offense, but women have makeup. They wipe their makeup off. They kind of, really, really get a close look on their eyes at times. But men don't really do that, and I notice that for sure. But people in general, these little pores start to fill up with gunk, bacteria, mucus, and we start noticing that there's really a problem in the clarity of their vision, and the signs definitely show up before the symptoms.
In a nutshell, can you tell us, is there any treatments for dry eyes?
There is maintenance treatment. So of course, taking your omega-3s like fish and your dark leafy vegetables have good nutrients in there too. But yes, taking omega-3s, drinking a lot of water, replenishing your water intake is huge. And also heat compress actually really, really helps, because it naturally melts that like buttery, toothpaste like tear film that's forming, and it allows the natural tears to kind of come up from those glands. So but there's so many different treatments and management mechanisms, and I do recommend patients ask their eye care providers about these.
Wonderful. Thank you. That's very, very interesting. So before we go, I was wondering, do you have a message that you could send out to our listeners? Because you've covered so many things. You've covered, like nutrition and, like healthy lifestyle. What would be your parting words to people, whether you're young or old?
So whether you're young or old, just remember your body is like a well-oiled machine, you must feed it with healthy things. You must maintain it. You must, go for some fresh air, get some exercise. The eye is such a beautiful organ. It's so well wired into the brain and the body. It's one of our 5 senses. It's so important to feed your body with healthy foods. So thank
Wonderful.
you for having me here.
Wonderful. Well, thank you for joining us today. We really appreciate you answering our questions and giving some insights into ocular health. And we hope to have you back. So hopefully you'll come back and see us again. And so Dr. Bandali, thank you so much. I want to tell you on behalf of myself and Martin and Ontario Opticians and our listeners, thank you so much. It was very insightful.
You're welcome. It was my pleasure.
Wow, what a great conversation that was this week. Such a pleasure to have Dr. Bandali on with us today on the podcast. That was awesome. Lorne, can you maybe let us know what we're looking at for our next podcast?
Sure, Martin. Our next one, we'll be talking about brain damage, vision loss in children. We'll talk about how mild traumatic brain injuries and how they become the greatest vision impairment for kids. So that should be really interesting. I'm looking forward to it.
That's great. Yeah, me too. This is something that definitely is going to hit home for a lot of people. Thank you, Lorne. We want to thank this week's sponsor, BrokerLink, great sponsor of the association. Thank you very much. We hope you enjoyed our Vision Month content as much as we enjoyed bringing it to you. We had fun. This was our first month of doing podcasts. We're looking forward to do some more. And on this, it's Lorne Cashin and myself, Martin Lebeau, saying thank you very much. And until next time on See What We See.
Thank you for listening to See What We See with Lorne and Martin. Be sure to follow us across our social media pages so you never miss an update or an episode. You can find us on Twitter at OOA_frontline. On Facebook and LinkedIn, we are Ontario Opticians Association. Follow us on Instagram at Ontario Opticians Association. That's all one word. We look forward to seeing you again on See What We See with Lorne and Martin. Take care and stay safe.